COVID-19 patients across the country are getting bills the U.S. government promised they wouldn't if they got sick. Chris Conti takes a closer look at why some insurance companies aren't doing the things federal guidelines say they should.
Long before an epidemic swept across the globe, Anna Davis-Abell was already spending her days trying not to get sick. She is 25 years old and has been living with lupus for most of her life.
The way that everyone feels right now is like the way that it always feels to live with a chronic illness.
It was early March after returning home from a trip that Anna started feeling sick. Even after taking a terrifying trip to the doctors, Anna was told there were no tests in the state of West Virginia where she lives. And then the symptoms got worse.
I was going from being super sweaty to like really cold. I developed a cough probably on like the third or fourth day.
Initially, she was diagnosed with the flu. When that didn't get better, she was eventually given a COVID test, a test that under federal guidelines was supposed to be covered by her insurance company. Imagine her surprise when a bill for $536.46 showed up in the mail.
I think it shows, unfortunately, that at the end of the day, it's a healthcare industry that's not first about health.
So what's happening here? The CARES Act mandates that insurance companies cover COVID-19 tests, but many Americans are finding out there are loopholes. Sometimes insurance companies bill them incorrectly, or in Anna's case, she got a test before the law went into effect.
Most people, when they get a medical bill, they're frustrated, they're angry, but they don't really know anything that they can do about it. And I feel like that's what the insurance companies are really relying on.
The COVID-19 billing and medical debt is going to be a nightmare.
Craig Antico is the founder of RIP Medical Debt. His concern is that many of us will just assume COVID tests are covered, and then months later find bills in the mailbox.
People aren't going to start feeling the pressure of paying these bills until almost a year from now.
As for Anna, after she called her insurance company multiple times, they forgave the charges.
As the discourse moves past the initial fears that we had, there's going to be less pressure on the insurance companies to be held accountable.
Accountability so that patients aren't suffering any more than they already are. I'm Chris Conti reporting.
If you think you've been overcharged, ask for an itemized copy of your bill so you can see and evaluate each charge individually. You might spot more errors. If your insurance company won't fix it, you can file a complaint with the State Insurance Commission.